All right, so in this one, we're gonna do a socket graft. I'm gonna first pull this tooth out, elevating a little bit, switch to the forceps, and rotating a little bit, and this tooth will come right out. And when it does, we're gonna get our curette and just clean out any periapical infection that was there and get it ready for a graft. Now I'm using this little plunger here to add some bone to the socket, and I compress it a bit. The compression is important. You want to make sure everything's evenly distributed and squished down in there. You don't want to overpack it and desiccate it. Okay, but you do want to make sure it's nice and packed and moist and bloody. You want that to clot up. So now I'm just packing it with a little condenser here. And now I'm going to use this collagen plug. This is a collagen plug. I cut it in half and I squished it up into a little circle. So this just is going to be a little barrier. Yes, might be overkill, but actually it holds in all the particulate graft and keeps it from coming out. So here I'm passing my suture through first, and I'm going to put that plug back on, and I'm just going to do a little one suture in one direction, the other suture in the other direction, forming a little X over it. You can also just do this with one suture. You don't have to do two interrupteds, but in this case, I'm doing two interrupted sutures. This is my first one, and I'm just going to carefully lay it over the top of that collagen plug. So you see that I'm passing the suture through, and now I'm just kind of gently putting that plug back down into place because it was just kind of popping out because I might have overpacked bone in there. But now that I gently put it in place, now I can cut that suture, and that holds it in its position. And I'm going to place another suture in the opposite direction. So you can see it's a little X over that collagen plug. That's going to keep all that particulate graft in there because, you know, we've all placed graft and then it just comes right out, and the patient says they swallowed most of it. So I want to make sure to give it the best chance it has to just clot up inside the socket. I'm finishing up my suturing here, just finishing up this little X. I'm just using chromic gut sutures for this socket graft. You really don't need to use anything that's non-resorbable. This will work just fine. All right, and I'm finishing up here. There's not really any magic to it. That was about it. Place my graft, place the collagen plug that I cut in half, and now I'm squishing it down neatly, and that's it.